Kristen, how are you doing today?
Okay, how are you?
Good. My name's Abby. I'm going to be your student nurse today.
Okay.
What brings you in to see us?
My heart's been fluttering.
Can you describe it a little bit for me?
It just started beating like really, really fast.
Okay. Real quick, can you just say your name and date of birth?
11-4. Kirsten Niker, 11-4-92.
All right. Thank you. So did it just happen today?
Yeah, I went to go to the gym and I was running on the treadmill and then it just got so fast I couldn't work out anymore.
All right. So did you go and rest and try to
Yeah,
relieve it? Or?
I just went to go sit down on the bench for a while.
All right. Do you have any family history of heart problems?
No.
All right. What about your history? Any diagnosis of murmurs? Have you ever had a heart attack?
No.
What about high cholesterol?
No.
Okay. Have you ever smoked?
No.
Okay. What about alcohol?
No, don't drink.
Okay. And what about caffeine intake?
Maybe like 3 cups a week.
Okay. About like 8-ounce cans?
Yeah.
Okay. How's your stress level?
Mild. I'm a full-time student, so that's a little stressful.
Right, right. And how do you cope with your stress?
Working out.
Okay. So you work out, how often is that?
Every day for 30 minutes. Well, I tried to, but I couldn't.
And you said it just started this morning.
Mm-hmm.
Okay. How do you sleep at night?
Pretty well, about 7 hours is good.
Okay. Are you on any medications currently?
No.
Okay. What about, have you noticed any changes in your skin color, temperature, any swelling?
No.
Any lesions? Okay. Any circulation issues?
No, I don't think so.
Alrighty. I'll just note that really quickly. Alright, so let's start off with our vitals and we can go ahead and start to take a look at what's going on. I'm going to just raise the bed to a level that is comfortable to work at. Alrighty. I'm going to start off with the temperature and taking your pulse ox.
Okay.
You see your finger, just clip that on there, have that sit there for a second. Oh. Okay, open your mouth, close your lips, it'll just be a second. .6, perfect. And the pulse ox was reading 100. Alright. Go ahead and take your pulse really quickly. Alrighty. So are you experiencing any pain when you notice the fluttering?
No, no pain.
Okay. Alright. Do you know your normal blood pressure?
120.
Alright, can I just take one of these pills? How often do you get your blood pressure checked?
Just whenever I go to the doctor.
Okay. Just raise your arm up. All tangled up there. 16 over 62. So about right. Just chart that real quick. Okay. Alright, so let's go ahead and get started with our cardiac assessment so I can report to the doctor. Alright, I'm just going to put this down. The pillow out of the way real quick. First, I'm going to start off by touching your 2 carotid pulses one at a time. Alright, they're strong. Alright. Then we're going to go ahead and check your neck for any distension or anything. So what we're going to have to do is lay you all the way flat. When we get flat, I will take your pillow away. And this is just going to check for anything in your venous system, see how the flow is.
Okay.
Okay. And we'll just gradually go up.
Okay.
But like I said, I'm just going to take the pillow real quick. Alright, and if you could, I just need you to look that way, away from me, so I can observe. And we're at a supine position. And the distension is noted. So let me go ahead and move the bed up. We're going to go to 30 degrees now.
Okay.
Sorry about the bed. They're a little squeaky there. Alright, again, just turn your head to the left. Alright, some distension there. I'm just going to check one more elevation, okay?
Okay.
And then we can get you comfortable. There you go. We're at 45 degrees. Okay, no distension noted. Good. Do you want your pillow back?
Sure.
Okay. Is the one good?
Yeah, it's fine.
Really quickly. Alright, now I'm just going to go ahead and take a listen to your heart, okay?
Mhm.
So I'm just going to go ahead and undrape this a little bit. First, I'm going to start off by palpating your apical pulse. Well, palpate, then I'll listen. So we're at the left mid-clavicular line, 5th intercostal space. Alright, palpable, but not visible.
Okay.
Alright, so try not to breathe so loudly just so we don't have any interference with the heart sounds.
Mhm.
First, I'm going to listen with the diaphragm. And this is the aortic and pulmonic. And that is where S2 is louder. Then we're going to go down to the tricuspid. And mitral. S1 is louder. And also, I'm going to take a listen to your apical pulse really quick for 60 seconds. Okay, take a listen to the bass. And then I would go over again and do that with the bell. So there was no adventitious sounds, no murmurs heard, no extra sounds. Note that really quickly. There was a little bit of a regular rate,
Mhm.
and that probably might be an underlying cause of the fluttering, which we'll definitely let the doctor know about.
Okay.
Okay, so we can go ahead and get you all dressed up there. Then I'm going to go ahead and just inspect your arms and see if there's any color changes. And you said you didn't notice anything, right? Okay, so let's just see if there's any swelling or lesions, color changes. Skin is warm to touch. You're a little pale. Is that how your skin normally is?
Mhm.
Okay. Alright, so I'm going to go ahead and listen to your radial pulses, or feel for your radial pulses on both sides. both strong. Go ahead and do the brachial. Alright, let's just go ahead and check your capillary refill. Okay. So those are good because it fills back up in 2 seconds.
Okay.
You want it to be less than 3. Okay. And also, so I'm going to go head to toe. I'm going to listen or feel for your femoral pulses. Okay. So keep you minimally close, but we just have to lift up your gown a little bit. Okay. Listen, feel them both. Okay, those are both strong. Alrighty, so I can go ahead and move down to your feet. I'm just going to go ahead and uncover your legs real quick. Alright, and again, I'm going to look for any lesions, edema, swelling that, again, you haven't noticed, right?
Mm-hmm.
Okay.
Right.
So we're no swelling. And again, like I said, your legs are pale, and that's normal for you.
Yeah.
Okay, so let me go ahead and feel your dorsalis pedis pulse. Alright, those are both strong. This is the posterior tibial pulse. I'm going to do the same thing to your toes I did to your fingernails.
Mm-hmm.
And those are refilling normal as well. I'll cover you back up. Alrighty, so I'm going to go ahead and report to the doctor. Is there anything you need before I go?
No, thank you.
Okay, so here's your call light. Call me if you need anything, and I'll be back to check on you, okay?
Okay.
And I'm going to put the bed down really quickly. Do you want your other pillow back?
No, thank you.
Okay. No, I do. I like this every day. Alrighty, Kirsten. Like I said, give me a call if you need anything.
I will.
Okay?
Thank you.